The American healthcare system is one of the most expensive healthcare systems in the world, yet ranks amongst one of the worst systems of most developed nations. It's a system that has been under scrutiny for years, yet little has changed. The complexities and the exorbitant costs continue to baffle and burden millions of Americans. We're talking about a system where people are forced to choose between their health and their savings. Imagine having to decide whether to pay for a life-saving treatment or to keep a roof over your head. This is the harsh reality for many. A system where a trip to the emergency room can leave you financially crippled. Emergency rooms are supposed to be places of urgent care, but for many they are the beginning of a financial nightmare that can last for years. We'll expose the shocking truths behind sky-high costs and explore some potential solutions. Why are we paying more for healthcare than any other developed nation, yet still struggling with access and quality? We'll delve into the factors driving these costs and what can be done to mitigate them. By the end, you'll be armed with the knowledge to demand better. Knowledge is power. One word: bureaucracy. It's a term that sends shivers down the spine of anyone who has ever had to navigate a complex system of rules and regulations. The American healthcare system is drowning in it. From doctors to patients, everyone feels the weight of this administrative burden. Did you know that we spend about 1/3 of our healthcare dollars on administrative costs? That's a staggering amount of money that could be better spent on actual patient care. That's more than any other developed nation. Countries with more efficient systems manage to provide high-quality care without the excessive overhead. Think about it this way: you go to the grocery store, you buy groceries, and you leave. Simple, right? The transaction is straightforward, and you know exactly what you're paying for. Now imagine having to file multiple forms, get pre-approvals, and deal with a mountain of paperwork just to buy those groceries. It sounds absurd, but that's essentially what our healthcare system is like. Healthcare providers are buried in documents, spending countless hours on administrative tasks instead of focusing on patient care. This inefficiency not only frustrates healthcare workers, but also delays treatment for patients. We need to streamline the system, cut the red tape, and make it easier for everyone to access affordable care. Imagine a world where healthcare is as simple as buying groceries. It's not just a dream, it's a necessity. By reducing administrative costs, we can allocate more resources to patient care, improve outcomes, and make healthcare more affordable for everyone. The time for change is now. Let's work together to create a healthcare system that prioritizes people over paperwork. Let's not be shy about this. Greed is a major factor driving up healthcare costs. It's not just a minor issue, it's a systemic problem that affects millions of people every day. We're talking about pharmaceutical companies charging exorbitant prices for life-saving drugs. These are medications that people depend on to survive, yet they are priced out of reach for many. We're talking about hospitals marking up procedures to astronomical levels. Simple procedures that should be affordable are instead billed at rates that can bankrupt families. It's like going to a restaurant where the menu has no prices and you only find out how much you owe when you get a bill for thousands of dollars. Imagine the shock and helplessness that comes with that. The lack of transparency in healthcare pricing is outrageous. Patients are left in the dark, unable to make informed decisions about their own health because they don't know what anything costs. We need price controls, plain and simple. Without them, the cycle of inflated costs and financial ruin will continue unabated. We need to stop treating healthcare like a commodity and start treating it like a human right. Everyone deserves access to affordable, quality healthcare, regardless of their financial situation. It's time for legislative action. We need our leaders to step up and implement policies that protect patients and ensure fair pricing. The voices of the people must be heard. From community meetings to national rallies, the demand for change is growing louder. Together, we can create a system that prioritizes health over profit, compassion over greed. The future of healthcare depends on it. Don't get us wrong, technology in healthcare can be amazing. But are we going overboard? The United States loves its fancy medical gadgets and procedures, often at the expense of more cost-effective preventative care. It's like buying a top-of-the-line sports car when all you really need is a reliable bicycle to get you to work. We need to find a balance between investing in cutting-edge technology and prioritizing basic preventative care. Sometimes the simplest solutions are the most effective. Rationing may be a dirty word or a smart solution. Now, before you clutch your pearls, hear us out. Rationing in healthcare doesn't mean denying care to those who need it. It means using resources wisely and prioritizing treatments that are proven effective. Think of it like a budget for your household. You can't just buy everything you want. You have to prioritize needs over wants. Other developed countries have successfully implemented rationing systems that control costs without compromising quality of care. It's time we had an honest conversation about whether this could work in the US. Sharing the savings provides a glimmer of hope. One promising idea is the concept of shared savings. This model rewards healthcare providers for keeping patients healthy and managing costs effectively. It's like giving your mechanic a bonus for keeping your car running smoothly, instead of just charging you for repairs every time it breaks down. Early results from these programs are encouraging, but we need more data to see if they can truly move the needle on cost and quality. Ideological gridlock remains between single-payer versus free market. The healthcare debate often gets bogged down in ideological battles between those who support a single-payer system and those who favor free market solutions. While these discussions are important, they often overshadow the immediate needs of everyday Americans struggling to afford care. We need to move beyond the rhetoric and focus on pragmatic solutions that work for everyone, regardless of their political affiliation. Beyond the jargon means making healthcare make sense. Let's face it, healthcare is complicated, but that's no excuse for the confusing jargon and lack of transparency that often plague the system. We need clear, concise explanations of medical bills, insurance plans, and treatment options. We need to empower patients to make informed decisions about their health without needing a PhD in insurance coding. Finding a cure means practical steps towards affordable care. So, what can we do? First, we need to demand price transparency from healthcare providers and drug companies. We need to hold our elected officials accountable for passing meaningful reforms that prioritize patients over profits. We need to explore innovative solutions like shared savings programs and consider lessons from other countries that have successfully lowered healthcare costs. It's time to stop accepting the status quo and start demanding better. This isn't just about healthcare, it's about our values. It's about ensuring that everyone has access to quality, affordable care, regardless of their income or zip code. It's time to raise our voices and demand a healthcare system that works for all Americans. Contact your representatives, support organizations fighting for healthcare reform, and spread the word. Like and subscribe now. This information was sourced from the Harvard magazine by David Cutler, titled "The World's Costliest Healthcare."